Welcome, I'm Jeff Patterson, Chief Executive Officer of Nacogdoches Medical Center, and we're here for another episode of Ask a Nac Doc. Today I have Dr. Tony Thompson with us, our Chief Medical Officer. Welcome, Dr. Thompson.
Thank you.
With your Hippocratic Oath, it begins, first, do no harm.
Absolutely.
And I believe that's transferable to hospitals. When people come in, whether it's to have a baby, a major surgery, a diagnostic test, you name it, it is of our utmost focus to ensure that we treat them and do it with the utmost patient safety with no harm.
Absolutely. When you come in to have with a medical condition or a surgery or to have a baby, you don't expect to have something bad happen to you in the hospital that's going to extend your hospital stay or cause you harm. And it's our job to make sure that when people come to our hospital that they're safe.
There's a lot of different metrics that measure safety.
What we look at are called HACs and PSI fault levels. HACs are hospital-acquired conditions. And the patient safety indicators are certain indicators that we look at. And there's about 12 altogether that we look at, and they include hospital-acquired infections. When you come in the hospital for a condition, you don't want to get an infection while you're in the hospital and then have to have that treated. And so we really look hard at hospital-acquired infections like central line associated infections and urinary catheter infections and the thing called MRSA infections that are hospital-acquired infections. And we're always looking at what we can do to prevent our patients from getting hospital-acquired infections.
When you look across the country, hospitals that do well in safety, they have clinical practice guidelines, they have bundles for treatments. Can you elaborate some of that for the general public, just really what that looks like?
When you and your family go to Houston to get on the plane to go for a trip somewhere, you expect to get there safely. And our model in healthcare is the airline industry. They have things like checklists that may sound super simple, but they go by checklists, and we do too. We have order sets that are best practice, and we make sure that our doctors use order sets that include everything, that something's not left out. You want your pilot on an airplane to go through his checklist just like you want your doctor to go through his order set. And we standardize care and we try to eliminate mistakes.
It's important, and quality and safety sometimes has to do with timeliness. Can you expand upon how, as being certified by the Joint Commission for chest pain and for stroke, how time plays such an important impact in defining
right?
quality?
And our stroke certification, we say, time is brain. When you have a stroke, the longer it takes to get that treatment, then you lose more brain. And it's the same thing with your heart muscle. We have chest pain certification, and we are here to take care of you if you have a heart attack. And we know that time is one of the most important things that we have to getting that vessel back open, and that your outcome depends on us being ready, prepared.
In a little bit more detail with respect to protocols, what are some examples of things we do in bundles for limiting central line bloodstream infections to associated ventilator pneumonias to urinary tract infections? What are some things that hospitals can do to ensure that folks are unlikely to get those hospital-acquired conditions?
We have checks and balances that doctors do and then the nurses do. We look every day, we talk about the best way to keep from getting a central line infection or a catheter infection is to get the central line out of the catheter out. So we ask the question on a daily basis at our different huddles of whether we can get that line out, whether we can get that catheter out. And then we make sure that we put the line in to a certain standard, because you have to use sterile technique, and the same thing goes with putting a catheter in. We want to make sure it goes in correctly, that it's monitored correctly, and then to get it out as quickly as possible.
An area of extreme importance for safety is in procedure areas like the operating room and cath lab. Can you talk a little bit about how we have universal protocols, timeouts, and how we ensure safety in the OR?
Yeah, when you go to the hospital to have surgery and you need a knee replaced, you expect to have the correct knee replaced. And we do have, it's called operative invasive procedure policy, where we do timeouts, and we do it every time before the patient's put to sleep. And we include the patient in it too, because we mark the leg. If it's the left leg, we mark the left leg. And we do it before surgery when the patient and the family are awake. They're awake, and the family can participate in making sure that we're operating the right side.
There's so many safety indicators out there. How does Nacogdoches Medical Center monitor and improve its safety scores?
Safety is the core of what we do. We have a safety huddle. All our directors and hospital leadership meet at 9 o'clock every morning, and we have a 15-minute discussion about safety. It's something that we talk about on a daily basis.
And then as far as that number of metrics that we're looking at as far as hacks and other acquired infections, how do we look at those?
Well, we follow all the hacks and we report those. We report it to our medical staff leadership, our meetings. We report it during our safety huddle, and we look at these conditions on a monthly basis. Two of the most important for us are two hospital-acquired infections. It's called central line infection and then a catheter-associated infection. And I'm proud to say in 2022, we did not have a single central line infection or single catheter infection for the entire year.
Well, that is to be enviable and expected. Safety is at the core of what we do at hospitals. We treat conditions, we treat folks, but we do it in an environment for promoting safety and good outcomes so they can go home and be with their families. Thank you for making the time to be with us today, Dr. Thompson. Thank you again for joining us for another episode of Ask a Nac Doc. We look forward to seeing you again next time. Thanks so much.